and welcome back to the channel. Today we are with Miss Esra Najeeb, who is an RBT, our Registered Behavior Technician. Today we're going to talk about ABA therapy and how it works and some of the misconceptions about ABA. Hello, Miss Esra, how are you?
Hello, Dr. Kausar.
Hello?
How are you? Nice to be here.
Yeah, I'm glad to
Hello, nice
I'm
to be
glad
here.
to have you with us. Yeah, we had some technical issues, and that's why we're running behind today.
Yes,
Oh,
actually, yes.
oh, okay. First question I want to ask you is what is applied behavior analysis or ABA, and how did it originate?
Well, a typical applied behavior analysis that is known ABA it is a therapy session is highly structured and tailored to the individual's specific needs and goals. ABA therapy is used primarily to support individuals with autism spectrum and disorder known as ASD. It can be applied to a wide range of behavior concerns, and there are a lot of typical sessions uh, in the form of sessions and in the form of assessment and in the form of goals to help achieve the aspects. So individuals within the development and behavioral disorders, it involve applying principles of learning and behavior to encourage desired behavior and reduce undesirable ones in the real world settings. And there are key aspects of ABA, such as behavioral principles, which is technique based on principles of behaviorism, which involve studying how behavior unfolds by their environment. It often focuses on reinforcing, and reinforcer is a rewarding desired behaviors, a punishment to discourage undesired behavior. So,
Yeah.
what actually relies on data driven, it relies heavily on data collection to assess behaviors, monitor progress, and adjust interventions as necessary. This ensures that the treatment is tailored to the individual's needs and is effective all over and over time.
Yeah, yeah.
So,
Uh,
yes.
yeah, go ahead.
Okay, there are, another key aspect is functional behavior assessment, which is a key part because it actually decides what the behavior is, what's causing the behavior, what is the reason for the behavior, and that is to actually determine what kind of procedure is gonna be, to encounter this behavior, whether it is because it's a problem behavior or a challenging behavior and we want to decrease.
Right.
So knowing the reason, yes, knowing the reason is actually very helpful and key aspect to uh, challenge or decrease or uh, this behavior we want to decrease.
Yeah. Well,
Uh,
something I always tell the parents is that you keep a diary of what caused the behavior, what was happening at that time that the behavior
yes,
started. That way we can
yes,
know some of the triggers on what is causing the behavior.
yes. Because it actually a very assessment uh, to be done. It actually study what comes after the behavior, what goes on before the behavior is happening.
Behavior
So
and what happens
yes,
during the
yes,
behavior.
yes. Well, yeah. What's the consequence? What triggered the behavior? and such on.
Yeah. Um, what are some of the core? Are you already answered this? The core principles, right?
Oh,
Um,
okay, yeah.
what types of behaviors does ABA aim to address?
It aim to address, mainly what, as a challenging behavior, or any behavior that you want to increase. Actually, if it is a good behavior, if a certain skill you want to learn and you don't know how, or a child, you want to increase something that is, good. You want to increase
Yeah.
his communication skills,
Right.
for
Our social
example. Yeah,
skills.
which is a very important, you know communication. I recently, attended, uh, as for behavior analyst, Italian behavior analyst, and she said Lucia D'Amato, if you must hear about it. And she
The
says,
one that Ahmed just did, right?
yes, yes, it was about differential reinforcement. And what she really says, she said something that is really important, and we have to know it. That is communication. Attention is communication. So when we have a child that has a attention problem or attention function behavior, it means that, oh, see me, and get to know me. It is attention. It's about communication. So communication skills is very important, because when a child, I also, when I, train a fresh graduate or something, I always say, okay, now it's like you have the flu. Okay, if you have the
Mhm,
flu and you can't really, speak, you get so frustrated. You sometimes do some things you can't, imagine that you did, and you are, you use your body. And sometimes, okay, now it is like you have the flu and you can't talk. This is what a
mhm,
frustrated child can do for getting the attention, because you can't hear his voice, you can't know his needs, he can't really say, he can't, express himself. So communication skills is very important for a child, and it is very important for everyone, actually.
yeah. Okay, we have a comment here. This lady is also a behavior therapist, so she has a comment here. She said we call that diary as ABC data. Yeah, I know about ABC
Yes,
data. So this is
yeah,
called
okay.
ABC.
Yeah, diary
Yeah,
is for parents. When we say to parents for the first time they're gonna, use EBA services, we tell them, oh, keep a diary. You're gonna need it.
yeah,
You're gonna,
yeah,
yeah,
yeah. Okay. Yeah. Actually, when you're talking about communication, I think a lot of times the parents I did a video on this just last week, I think. The parents, they get frustrated, but also the child, he gets frustrated, you know? So
yes,
like you
yeah,
said, when a child is, if they have the attention, whatever they're doing, even if they're nonverbal, that is communication. If they're trying
yes,
to pull
yes,
you, that's communication.
yes,
They're trying to
yes,
tell you something. So the parents need to
yeah,
understand actually what the child is trying to tell them, what a child is trying to communicate to them.
yeah.
Okay,
Well, what are
listen to,
they trying to express, actually? Yes.
right. Um, how is ABA therapy tailored to an individual child's needs?
Well, it is, it's an individual, so
Yeah,
when you are trying to customize a plan or customize an assessment even before, you are doing it on this subject, this client, this child is on its own. You are studying and researching, observing and collecting data on this individual only. So what all you can do, all you are trying to do is to assess and assess and customize a plan specifically for him and his environment and his behavioral issues and his skill acquisitions and his everything. So what are you trying to do is improve his and enhance his life, experience and
Mm-hmm.
his skills. So
Yeah.
this is a tailored, customized
Yeah.
plan, customized, service for him.
Yeah, usually what we do is we do observations. For the first couple of weeks that
Yeah.
they're coming in, we're doing observations to see what the child needs, what kind of issues he's having. Is he having meltdowns? Is it communication? Is it social? What exactly is? And then we devise the plan based on what we've seen in our observations. And then I guess within three
Yes.
months, we might change the plans if we need to change the plans.
Yes, you're always assessing what progress it has been done. If you want to, change it a little to get a lot of, more progress. So what are you doing is not not doing assessment and it is done. No, you always, do assessment to get
Reassess it.
the progress and what have been achieved, after.
Hmm. Right. Okay. What is okay. What would a typical ABA therapy session look like?
Okay, well, that's a good question. An ABA session, like we do the goals and we train the child for it. And what we are doing, we are, introducing the skill. We want to train him for it, and we set the prompt and set the enforcement, and it is customized according to the skill, according to the assessment of the child, according to his potential, according to his behavioral challenges, if we want to
Yeah.
increase or decrease. So a typical session is including what's his break, what does he like, what he doesn't like, how can we improve his skill and improve training. So it's all about the client, all about his needs, and all about his challenges.
Yeah, exactly. What are some of the key techniques used in ABA, such as reinforcement or prompting?
Well, mostly prompting accordingly to the plan and accordingly to what's the new skill and what's not so new we are trying to maintain, or we trying to increase, okay, or building a repertoire or something like that. So prompts is very versatile, very different, and we according to the plan and according to the assessment and his potential, whether he is in a progress or whether he is like in stage one. So we are trying to build the prompts according to the hierarchy of his
Yeah, yeah.
learning.
Mm-hmm.
Yeah, so yeah, reinforcement is such, it's all about what he likes, what get him motivated, and what will make him, oh, I must do this. I like doing this. It's all about what
Yeah.
he likes and what, yeah. So we
And
get
what
him
will make him
motivated.
cooperate?
Yes, yes, actually, because I always want him, you know, like to learn, like to be with me, and like to, okay, we have to do this and get a sense of accomplishment. So reinforcement is, I'm not building to get what he wants right now. I'm building it to, get him motivated afterwards. And, we reach the level where he, okay, I'm doing this for the skill itself, not for me or not for the, kind of reinforcing that he wants right now.
Yes, yes, yes. Um, how does ABA therapy measure progress? That's a very good question.
How does ABA, I'm sorry, what?
Measure progress. Measure progress
Okay,
of the
okay.
student.
Through data collection, I always, record record sessions, record the progress that we did. So we have to review this, and we have to, do meetings for the team, and we have to, oh, okay, we now, you know, mo- uh, collect the data about he is getting progress. So it's all about the data actually, because it's not like arbitrary, so okay, now he is good, so what's good? Show me. I mean, show me, yeah, show me with data.
Yeah, yeah. Data is very important. Um, what age groups do you think benefit most from ABA therapy?
Well, I think what uh, I can all. I've never met an ABA therapist or even an ABA mom that her son is doing or daughter doing therapy, ABA therapy, and she didn't say come up to me and say, "Okay, I've benefit from ABA for personally." She say, okay, it's about organizing, it's about a routine, and getting the benefit of routine, and get the benefit
Yeah,
of organization, and it has like more insightful
yeah,
uh
yeah.
yeah,
But I
perspectives,
think
yeah.
But I think the younger the child, the more benefit the child is going to get from the
Yes,
therapy. So if
of
you get a
course,
child
because
that's 3 or 4, of course they're going to
yeah,
benefit more than a
yeah.
child that is 15 or 14. So
Well, because
of course the younger
it's
child,
a more of how did you apply it. If you did apply it, in a good way, or like you didn't apply it very good, because it's all about improving your life and improve client's life. If you don't apply it, organizedly, you're not gonna get this benefit. It's always
yeah,
about
true. It's not just about the therapist, it's also the implication at home, how the parents are actually
yeah,
working with the therapist. So if the
yes,
therapist is taking all of this time to work with the child and the parents aren't doing what they need to do at home, then of course it's not going to be as beneficial as if you're working together.
yes, yes,
Uh,
of course, because yeah, I did attend the ENBA for the European National Conference, and they were hosting this lecture by Dr. Fernando Armirez, and he talked about empowerment of ABA to the parents, and how it did beneficial, because okay, 3 hours of the day, and the rest of the day is with the parents. So what
right.
it did, when you train parents, and it actually, he can apply all the skills that you train it for only 2 years. He has the rest of the day, he has more than 10 hours a day with the child, and that what gets him empowerment, because he can, through NAT, through his life setting, that he can make more progress.
Right, exactly, 100%. Yeah. Um, can ABA therapy be effective for other children with other than those with autism?
Of course, because it's about organizing his life routine, his using motivation to keep him motivated, to get certain skills, and increase, and it actually decreases what you don't want to learn, or what you don't want him to be a challenge in his life.
Right. Yeah, I think also, I mean, it's good for kids that have ADHD, that have a lot of behavioral issues. It's good for kids that have social problems. It's even good for kids that maybe have communication issues. So I find it
Yes.
across the board. It was
Yes.
developed, I think, more for autism. But if you look at Montessori, for example, it was
Yes.
developed. Who was it developed for? It was developed for children with intellectual disabilities. Now it's used
Yes.
for everyone.
For
All
everyone,
kids.
yes, yes,
For
yes.
all
And
kids.
I recall that Lovis program, because I did work with يعني with the Lovis program a lot in the early 2000s, and it was all about the Lovis program. It was a huge thing back then, and what was originated from, teaching normal kids. It was
Mm-hmm.
originated to teach normal kids, about routine, about, self-discipline, about skill, teaching. So
Mm-hmm.
now, when I worked with it, it was only with ASD and Down syndrome. Yes,
Mm-hmm. Yeah. Yeah. So these programs, they go across the board. You can't say,
yes,
okay, this is ABA. It's only for the
yes,
children with autism, because it
yes,
helps other children as well. Just like you can't say Montessori is only for
yes,
children that are intellectual disabled. It's across the board. It's great for all kids. Actually, Montessori, it helps
yes,
them in a
yes,
lot of
yes,
different ways. Okay.
yes.
Now we're going to go into benefits. How can ABA therapy help with communication and social skills?
uh, how can it help communication
Yeah.
skills?
Yeah.
Yeah,
How can ABA therapy help with communication and social
so
skills?
okay, social skills, I think the mainly skill on social skills is communication. So
Mm-hmm.
when we, and good communication, functional communication, and this is a main point, main study, and main aspect is functional communication training, which is, okay, I'm not trying to teach you, oh, it's verbal communication skills. No, it's about what the client can do. If he
What they
a
can do.
nonverbal,
Mm-hmm.
yes, if he's a nonverbal, what gonna do? We're gonna train him to sign language. We're gonna train him to exchange picture, or communication tablets,
Devices.
communication
Yeah.
devices. Yeah. So what's functional mean is that uh, it is what a child can do. It is functionally
Yeah.
here. It's what a child can do accordingly to his potential and according to his situation. We can't
Right.
just, judge, okay, you have to train only by words, or only by pictures. If he can't, get this visual differentiation that he can do, he's still in learning. What can I do? I can teach him a lot of different things to
Mm-hmm.
get to this, kind of, when we increase his differential visual differentiation. Now we can learn him, teach him by uh, visuals. Okay.
Yeah. Yeah.
So until
Exactly.
then, yes, yes.
Um, what are some success stories or examples of children thriving with ABA?
A lot of different. I've seen it, like change a lot of, aspects of life for
Mm-hmm.
children and for parents also. Because when a parent comes up to you and I can't, deal with this, challenging behavior, I can't deal with this, he has some low expectations. and he, see the progress that we have done, and he really convinced that the child is, doing a lot better. Because when some parents, come up and say, oh, I can't really know what he wants, and when we
Mm-hmm.
give him the mean to communicate with him and express himself, he's now, oh, he's a completely different person. So
Yeah.
now we can, get, like this line of communication that he actually, if it with the device or with a picture, I don't care. It's getting the line of communication.
Mm-hmm. Well, I've seen kids also come in and they're aggressive kids, very aggressive
Yeah.
children.
Yes.
And, our behavior therapist has worked with them for a long time, and they have gotten a lot of good results, by reinforcements, by um, tokens. Our behavior therapist, she likes to do tokens, and we have found that has worked really well. And the reward system, it's not like you use it forever. And you use it when they first come in because they need that reward system to have something to motivate them. And then gradually you reduce the reward system so they're not being rewarded as often. But
Yeah.
I've seen a massive difference in some of the uh, I have seen massive difference in some of the kids that is, have come in, especially with bad behavior, especially with aggressive behavior, and how they have thrived after going through ABA. And some of them have done CBT, but ABA, I have seen a lot of difference, in the child's behavior. We have two comments. Okay, hold on. Show. Let me see. I have a question. I just recently communicated with a friend whose child has ASD, and her OT said that he is nonverbal because he's not commuting and comprehending, but the child can talk. We actually, here in Oman, we would call that semi-verbal. We would not call that nonverbal. So, here if a child has speech, we call that semi-verbal, right? Yeah, we would call it semi-verbal here. We would not call it nonverbal. You're in the Philippines. Maybe it's different, but that's odd because I have OTs that from the Philippines, and they also use the term semi-verbal. If a child can talk, but they're not up to their age group or something, we would usually call that semi-verbal. Um, so, that's what we do here. How about in Egypt? Do they call it semi-verbal or non-verbal if the child can speak? Isra? Okay, she turned off her microphone. I don't think she can hear me. Isra, your microphone off. Hold on, let me send you.
Hello.
Oh, yeah, you turned off your mic. Okay, all
I'm
right.
sorry, I got freeze. Actually, my screen frozen.
Yeah, yeah, we have some technical challenges with Egypt. We
Yeah,
also sometimes have technical
yeah,
challenges with
yeah,
Malaysia.
yeah, yeah, yeah.
Yeah.
Yes,
So,
yes.
um,
You're right.
yeah.
So
So,
here in Egypt, when we, like sometimes we say, okay, as experts, we are dealing with the phase at a time. Dealing, we are not dealing with the diagnosis. We are dealing with the symptoms. Okay, because
yeah,
the parents get so, uh, occupied with the term and the diagnosis, and leave behind the symptoms. Okay, so we are not relying on the diagnosis, we are relying on the symptoms and how to address it. So
Right.
when we
Right.
address the symptoms, it's actually a functional, um, a more
Yeah.
practical,
But
because
yeah,
yes.
the in
So
this case, the child.
yeah, if it's a speech delay, we are facing it. We are putting it, as you know, uh, a first actually, because
Yeah.
what is it? Okay, now we have
Yeah.
to get involved and we have to work on it, because
Yeah.
communication is very important, and we did say this communication is the most, you know uh, first top um, skill,
Yeah.
and we have to
Yeah.
achieve it. Yeah, so
Yeah.
we don't really, rely on, okay, it's a nonverbal, or give him a mean to communicate, and then we can address the other issues.
Yeah. Here, because the child, his function is that he does have speech. So we would not classify him as nonverbal. We would classify him as semi-verbal
Yes.
speaking child. So
Mm,
she's just
yeah.
curious if this would
Yes.
be right and or wrong. But I consider that the what the occupational therapist said is not correct
Yes.
because he does have speech. So he would be considered as
Yes.
his functioning is as semi-verbal.
Yes.
Okay.
So that
Um,
is quite okay.
how can ABA therapy improve a child's independence in his daily tasks?
Well, what we are trying to do with ABA is, make him, we are introducing prompts, of course, but mostly what we are trying to achieve is to fade the prompts as it possible. So, what's the first thing we are teaching? What's the first thing a therapy must have in his mind? And it's his first goal is to fade the prompts as we go along in the training, because that's how we build the independently that we want. So we are using the prompt hierarchy to
Mhm.
slowly fade the prompts, and he doesn't, make it a reliable and achieve reliability. So
Yeah.
that's how can an ABA, work on the independence, because eventually we are trying to make him useful, for himself, and independent for himself and his self care and his self independence.
Yes. What in what ways does ABA therapy support families?
Oh, okay. A lot of things actually, because families, we want them to be engaged in the ABA therapy, and we are doing initially interviews and assessments. We are, knowing, make them, okay, get the information that we get from them initially, like what he likes, what he doesn't like, what their cultural sensitivity, and we are doing what values clarification and collaborative goal setting. We are doing an open communication. We are offering, like, um, parent training and caregivers training, because we want them to be on the same line and the same plan and the same goals
Yeah.
that we are trying to accomplish with the client.
Yes, exactly. Um, okay, how can parents and caregivers be more involved in ABA therapy?
uh, they can be more, because we are keeping the line of communication are open. We are modifying, keep our goals adaptive. We can modify goals or methods as needed based on cultural and instance. And some families may prefer less verbal behavior and intervention, and more nonverbal or visual support. That's how we keep the goals adaptive, and we are keeping ongoing communications. for regular check-ins and feedbacks. Schedule regular. We are scheduling regular check-ins for the family to assess if the ABA goals are still aligned with their evolving values and priorities. So families may have new goals or changes in priorities over time, and it's important to remain flexible. We are encouraging the family to provide feedback about the intervention's effectiveness and whether the goals continue to match their expectations. And also on ecological consideration, we are considering the family day by day routine and environment. So when actually you know, they are saying to me, okay, we want to go to a kids area or a kids park, and it is important for us to learn how to, you know, get the line, you know, waiting skill. We want them to teach that. That's what we are prioritizing in our plan for our training skill.
Yes, yes. Okay, I want to move on to addressing some of the controversies and misconceptions. Why do
Sure.
some people criticize ABA therapy as being too rigid or controlling?
Okay, so how I say it, okay, I say this. When we have medicine or medication, we always say, oh, there are some side effects. They can, you know, work with some and not work with others. That's how, you know, a medication which is scientifically researches and scientifically made and all this, and it is, you know, we have, you know, sometimes they work with everyone, and okay, that didn't work with me. So that's how an ABA gets, you know, some rigid recalling or something like that. So if someone came up to me, okay, there are a baseline that we are, you know, keeping, and that's how it used. Some people, you know, some therapists maybe, you know, like didn't do it correctly, didn't, you know, specifically made it very good or apply it in a good way, and that's not what we are doing. It has some, you know, if the flow, it's about the therapist. It's not
Right,
about
right.
the, you know,
Techniques.
yeah, it's not about the yeah techniques itself, because the techniques is evidence based. It has been researched for over, you know, more than, you know, 3 decades, 4 decades. So it's not about, you know, it's these allegations is about you know, some therapists that our past experience that wasn't very, you know, good.
Yeah, right. Um, how do you respond to claims that ABA is like dog training for children? This is what we talked the other day.
Yeah, yeah. Yeah, well, I see, if you, you know, I recall that in some, you know, some ages ago, when there were allegations that a school system is not useful for children, and the death to school, there were, you know, some, you know, allegation far back in 1800s and 1900s, and the school system is rigid, and the school system is not working, and death to school, and all these, I see it, it is now we are facing this in these allegations. It's like this already, because
Yeah.
okay, now the teaching methods, how can we say that if the teaching methods are individualized and customized to only the individual? How do we, you know, if it is a dog training dog, if it is not assessing, it is not, we don't do assessment, we don't do what he likes and what he doesn't like, so it
Well,
is far reach, you know.
yeah. Well, I look at it like this. if you have neurotypical children, so you're going to teach them how to control their behavior. You're going to teach them daily living skills. You're going to teach them how to communicate socially with people. What's the good thing? What's the bad thing? Right?
Of
So
course, of course.
why aren't you going to teach the same types of skills to a child with autism? Then,
Yes,
we do that through ABA mostly, right?
yes, yeah,
So
yes,
I
of
don't,
course.
for me, my son went through ABA. So I don't find it abusive. Yes, sometimes you
Yes,
get a bad therapist that is abusive. So we can
yes,
say, yeah, the therapist can be abusive and you need to monitor that. But the techniques themselves, what is the techniques
yes,
doing?
yes,
They're teaching kids the way to communicate. They're teaching them how to behave. They're teaching, them social skills. They're even teaching them how to function better in a school. We're not saying to remove their personality. This is what some of the people are saying. Oh, it's removing their personality. We're not saying that. The child's
yeah,
personality is his personality, but we're
yeah,
trying to teach them just as we would
yeah.
neurodevelopmental
Well,
neuro.
that's basic foundation for a good living. We are
Yeah, for any
enhancing
child,
yeah, we are
for any
enhancing his
child.
whole life experience. We are enhancing what's socially validating so he can be really functioning in his life, in other lives. And if we are trying to teach that to a dog, then we are not compatible. And that's, a far reach allegation. So we are
Yeah,
not trying to teach a dog how to be benefit. We are not teaching him how to be independent. These are, far reach and not acceptable allegation for us, because the people that
yeah.
work with the ABA know how to differentiate these allegations and know that
Hmm.
it's not so, to
Yeah.
rely on.
Some of them are coming through the autistic community. Okay, we can see these people. Most of them are 30, 40 years old. I can say maybe back 40 years ago, yeah, the therapist might be more abusive than they are now. Now with ABA, we're teaching more positivity, like
Yeah,
ignoring bad behavior if it's not dangerous and focusing on the positive things, giving them positive
yeah,
feedback.
yeah,
So
yeah,
this is what we are communicating through ABA, is
yeah,
to try to ignore bad behavior that is not dangerous and focus on positive behavior by giving them a good, positive
yes,
feedback. So
yeah,
back 40 years ago or 50 years ago, okay, we can say that there is some issues there, and then we can say some of the adults that received ABA, years ago, yeah, they could have had a therapist that was abusive. But
yes,
ABA has evolved, especially the
mm,
last, I would say, 10 to 15 years. It's evolved
yeah,
more since my son was having ABA. So he's
yeah,
24. So I,
mm,
I know it's evolved and it's more, they have changed a lot of their techniques to be more positive, more engaging,
mm,
more kid friendly.
yeah,
So for
yeah,
me, yes, I've had bad therapists. I've seen bad therapists. And it's not only
yeah,
ABA therapists. It's
yeah,
special education
yes,
teachers, it's occupational therapists, it's speech
yes, of
therapists.
course.
Anybody that has had a school or a rehabilitation center, they have seen this.
Yeah, 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 yeah.
They have,
We in
you know,
school system we mostly see teachers that are people tell them that they are abusive. So it is all over.
yeah.
It's not
So you
ABA.
can't you
Yeah,
can't blame a technique for the abuse. It's not the
yeah,
technique, it's a
yeah,
therapist
yeah,
or a teacher
yeah,
or
yeah.
an occupational therapist or a
Exactly.
speech therapist, a psychologist. It's not, the techniques. The techniques are good. I've looked at the techniques myself.
Yeah,
I
yeah,
have, I've had therapists. So, you can't blame a full therapy for the behavior of a therapist.
Yes.
I've seen very abusive therapists. And
Yeah,
I
yeah.
saw one
So,
on Instagram one time,
and
and I said
nowadays
something.
it's a focus on the emotional well-being of the individual. So ABA shouldn't just focus on behavior modification, but also on emotional support and building self-esteem. If the therapy,
Right,
some the therapy is, we are building it on the strength of the client or the strength of the child in order to get it to the most, uh, difficult, skill for him. So we are building it from what he knows to what he needs to be trained for.
right,
And this is how
exactly.
we are building, yeah, the emotional well-being of the individual.
Okay. The next question is pretty much we covered it. Is a therapist abusive? How do you ensure it's a positive and supportive experience? That's the basic question.
Yeah, yeah.
How
And
can
keeping the
you,
family, keeping the family feedback, the line of communication, we already said that, and
yeah,
using evidence-based methods, collaboration with families. It's crucial that the parents and caregivers are involved in the therapy process. They should be trained
yes,
and to set the home and have the opportunity to provide feedback. Therapy should feel like collaborative, supportive, partnership,
yes,
not the top down
yeah,
directive process.
right, exactly, exactly. Um, what safeguards are in place to prevent unethical practices in ABA? I
Well,
would think that would
of
depend on the
course, we
place,
have to
the
mention,
environment. Yeah, the
yeah,
school,
of course.
the center.
Okay, yeah, we have, like a big thing here. We have like the code of ethics, which is for a behavior analyst certification. We are, doing and studying a big part with the ethics, and it's a certifying body of behavior analysis and establishing a comprehensive code of ethics that guide the professional conduct of behavior analysis. So we have the client welfare, we have the integrity and non-discrimination of the ABA therapy, responsibility to a client, ongoing professional training and certification. That's all in the code of ethics, and ongoing professional training and certification, because we must maintain the certification by ongoing, always, do professional
Yeah, I think every
development.
year, right?
Yeah, yeah, yeah. I recall, when I was younger, I had, doctors in the house, and okay, where I've seen them always, studying for a board or for a partnership, and okay, now I'm like them. And now I understand. We are always studying for, we are always attending, conferences. We are always, have these events, and the supervision and oversight, of course, supervision by experienced and certified professionals is a critical safeguard. Practitioners,
Yeah.
especially
I mean,
those
in
who
our
are newly certified. Yeah, because I used to think, okay, now I get the certification and that's it. Okay, that's not it. Newly certified or working with complex cases must receive supervision from a qualified senior behavior analyst. This mentorship helps, ensure ethical and practices and high quality service delivery. So,
yeah,
and also an evidence-based practices which relies on scientifically validation methods, because we always get the paper and or the recent papers and on evidence-based intervention are required to demonstrate their effectiveness through rigorous, research. Behavior analysts are trained to prioritize intervention that have empirical support to ensure that practices are safe and beneficial for clients. So that's
Yeah.
how we are, safeguard
Yeah, for
in
us
IBA.
as a center or for
Mm.
a therapy center or whatever, it's through observation or cameras and things like that, so we can make
Yes,
sure
yes,
that the child isn't being abused or hurt or something
yeah,
or something like that. Um,
yeah.
what where is it? How does ABA therapy respect a child's autonomy and individuality?
Well, as we said that, individualized treatment plans, like personalization, when ABA therapy starts with a detailed assessment of the child's strengths, preferences, and interests and needs, the treatment plan is individualized, ensuring that the child's unique ability and challenges are taken into account. This approach helps the child feel seen and respected as an individual. So, what therapy goals are chosen collaborative with the family and sometimes the child, depending on age and ability, that ensures that the goals are meaningful to the child's life and contribute their personal growth rather than being imposed externally. So, also an incorporation of the child preferences and choice and motivation. So ABA uses the child preference and motivation tool as a motivation tool. For example, rewards are not, often referred as a reinforcer are based on what the child value as favorite toys. So or social interaction by making therapy enjoyable and related to the child preference. ABA respect their individuality and choice making. What ABA therapy frequently includes opportunities for the child to make choices, whether it's deciding on which activity to engage or how they want to approach a task, giving the children, the opportunity to express their preference for autonomy. And also,
Yeah.
what we are doing with the naturalistic and play based approaches, it's naturalistic teaching, which many modern IBA programs now use, like pivotal response training and early start, intervention, where early start Denver model use naturalistic technique that happen in real life context, such as playing with toys, interaction with peers, and participating in family activities. These approaches honor the child's natural environment and ways of engaging with the world.
Okay, we have a question here, and I'll let you answer this because this is a very specific question.
Okay.
Okay, it says, "How can I learn about ABA therapy for an hearing impairment in phonetic therapy and behavior therapy?"
Okay, by studying the techniques, and the techniques actually, we get it engaged in the basic skill of the child that has, and what repertoire he has of skills, and different skills. So we do get it involved and get it in the skill and what we are trying to focus on, our prioritize his skill that we are trying to decrease or increase, a behavior or a challenge, or we are trying to teach him social validation skill or social validation behavior. So what it's built on the child itself, and we firstly, okay, we have to learn the technique and then try to get it in the child routine and potential and a set of skills basically.
Yeah, I think the person who's asking this, they need to maybe learn the techniques through an ABA therapist, or they need to
Yes,
take courses to learn
yes,
about
yes,
ABA.
Yeah,
We
so
have another.
what we are, yeah, so what we,
Yeah,
as a therapist, we do, study like the first 40 hours of training, which is basically teach us about the basic techniques and the basic strategies. And then we are trained and how to get, how to read an assessment, how to, get a practical approach to how to use it on, a set of skills or set of behaviors or whatever you want to increase and decrease, basically.
yeah. Okay, this guy has a comment. I think he's right here. Okay.
Mm.
He says, I see, wait a minute, something popped up. I see ABA, let me see. I see ABA as respect for the child of how he is, not how he should behave. I see ABA. Yeah, I think he's saying I see ABA that it respects the child of how he is, his personality, and
Yeah.
not how the child should behave.
Okay. It is about, like what he is. I am acceptable for it, but I want to help him, to be more engaging, to have, if he has a challenge of some way, if he has a challenge in a behavior, if he has a challenge in a certain skill that is keeping him from, be better. It's actually being, the experience of being better than you are right now. It's about, development. Okay, I'm accepting him as he is, but I want him to be more better. If something is not, if a child, like sometimes we get this a lot. He has, like difficulty in mathematics, so I want him, to get through this because mathematics is important. I'm not saying that he is bad, or I'm not saying that he is, has impairment of some kind, or, that he is, falling down from his peers or something. No, I'm saying that you are as good as you are, but I'm going to help you to improve yourself, be a better, um, uh, persona of yourself.
Yeah. Okay. Mohammed also has a second question. And this, I think he might be an ABA therapist. I have a question. What should we do in the case of the shortage of centers that work with ABA and during the increase of technicians? I think he's referring to there's not enough positions in the centers because there's so many
Yeah.
people going for ABA therapy.
Yeah. So, this is actually a very good question because nowadays we are seeing the increase of therapists, but not the very best, increase of centers because, a lot of different circumstances. But we can, always go for like if you have a supervision and you have a case, why not work with the supervision, under the supervision with
Privately.
the case privately?
Yeah.
Yeah,
Yeah.
so
So,
a supervision is actually a key aspect to work for freelancing, as long as you have a constant supervision with you and the case.
right.
So you don't
Exactly.
have to, yeah, even if you are a fresh graduate or a fresh certificate, you know applier, you can always work with a supervision, and a supervision can get you to this level of proficiency.
Yeah, yeah, I agree. They can go through to and work with children privately just as long as they have the
Yeah,
supervisor.
but the
So,
yes, the supervision now can be remotely,
and a lot of parents like
supervision, an
private. So,
online supervision, which is now,
yeah,
you can video it and keep the progress and keep the data, and
mhm.
do meetings, set meetings and everything during online, and that's
Exactly.
very, yeah,
Most of the ABA therapists here that I know are doing online supervision. The
yeah,
supervisors are
he
doing it
also,
online.
yeah.
Yeah. Okay. What changes have been made in ABA practices over the years to address past concerns?
Well, yeah, as you mentioned, applied behavior analysis has evolved significantly over the years, with several key changes made to address past concerns related to its application, particularly when working with individuals with autism and other different developmental disabilities. And there are, main ways in which ABA practice have adapted and improved, such as focus on positive reinforcement and ethical practices. So the past concerns were early ABA practices often used aversive techniques, including punishment, or to modify behavior. These methods raised significant ethical concerns and were criticized for causing harm or distress. Now, the change was modern ABA practices emphasizes on positive reinforcement, which is basically خلاص, you are focusing on ignoring the undesired behavior and giving the reinforcement to the desirable ones,
Yeah, the
where
desirable
desired
behavior.
behavior are encouraged, yeah, encouraged by rewarding them, and aversive methods are used only when absolutely necessary and as part of an ethical framework. There is now a
Yeah,
strong emphasis on treating the individuals with dignity and respect.
right,
So
exactly.
increased focus on social, yeah, and functional skills also, because traditional ABA often focused narrowly on reducing problem behaviors without considering the broader social communication and life skills of individual. But now
Yeah.
the change that current ABA intervention emphasize functional training, communication, social skills, adaptive behavior, or programs are designed to improve overall quality of life of the individual by helping them function more independently in everyday situation and interact more successfully with others.
Yeah, I think some of the complaints that you see online is just some people not really investigating more deeply, and they just see people complaining online, oh, it's abusive, it's like this, it's like that, but
Yeah,
without
yeah,
actually the real evidence, especially the how it's evolved in the last year, because it's more in a positive light
yeah,
instead of a negative light, where we try to
yeah,
encourage, more positive behavior, where we don't focus on the negative behavior unless it's dangerous. So, I think they're not
yeah,
really looking into what the new ABA is about. They're just seeing this online or
yeah,
that online, and they're just giving their opinions without really investigating on what it is. Okay, we have another question. Now, this
yeah.
person already asked one question. Let me see.
Okay.
I think she's talking about speech therapy. Is ABA therapy? Does ABA therapy have techniques in phonetic therapy? I think phonetic therapy. She means speech therapy.
Okay. Of course, because we have speech therapists that are introducing during their sessions the ABA techniques, which is fundamentally in the sessions, because we are, relying on reinforcement, we are relying on prompting, we are relying on, scheduled reinforcement. All of this you can include during your session, and it actually increases the effectiveness of the session you are doing in any sort of therapies, whether it's speech, occupational, whatever session you are doing with a child actually.
Yeah, yeah, because we already talked about it, how we can teach communication, not just verbal communication, but nonverbal communication with ABA.
Yeah,
Because she just came on, so maybe they can go back and look at that place where you were talking about the
yeah, yeah,
communication.
yeah,
How do you approach clients who are hesitant about ABA therapy due to misconceptions?
yeah. So when we approach clients who are hesitant about applied behavior analysis due to misconceptions, it's important to take a compassionate, informed, and respectful approach. Because here is the step, by step process to address these concerns. We can listen actively and empathetically, because you can't always, like, treat them as they are a case, you can put some empathy in this. We're starting by listening carefully to their concerns and hesitations, and acknowledge their feelings and validate their experience, because they can come from a past, bad experience, and you can validate this, and you can, acknowledge their feelings and hesitations. This establishes trust and shows that you are genuinely care about their perspective.
Yeah.
And you can always, say, I completely understand why you might feel uncertain about ABA. It's important to address your concern, and I'm here to help you clarify these things for you. And always provide accurate information to explain what ABA therapy is applying, and highlighting that is evidence-based practice and how it is customized to meet the unique needs of each individual. So we have to focus on the positive outcomes, such as increased independence, improved communication, and better social skills.
Yeah.
So
Yeah.
what
I
ABA therapy can be is well researched. Yeah, well researched approach that focuses on teaching new skills and reducing challenging behaviors through positive reinforcement. It's not about forcing anyone to change, but helping them reach their full potential at their own pace.
Yeah.
So
Yeah, I think if parents have had that experience with other therapists, it's difficult
yeah,
for them.
yeah,
So, we just have to
right,
reassure them that it's not the tech, like I said, like we've been saying through this whole podcast, it's not the techniques,
yeah,
it's the therapists. So we just have to
right,
reassure them that,
yeah,
okay, we're going to do it different. You'll see that, we're different than the last therapist, and so that
right,
try to relax them and let them to understand that not all therapists are the same. So like I said,
yeah,
you can find abusive teachers, you can find abusive therapists,
yeah,
so
yeah,
we have to reassure them. Okay, we have another
right.
question from the same lady. Okay, what age is the age that I can get ABA for kids or adults with special needs?
Okay, we have answered this actually. You,
Well, early
okay, we said
intervention
it
is the
is,
most
yeah,
important.
yeah, it's more effective for everything. I say early intervention is the key, main thing that we work on, because it is what it is. It's an early for everything. It's an early intervention for skills. It's early intervention for, set of behaviors. I prefer early intervention. So, but I see it. I saw it do, you know a lot of progress to, more advanced kids and more, like adults. So it is
Yeah,
what it is. It is according to evidence based. It can work with anyone.
it can work with anybody. I mean, but of course,
Yeah.
we would prefer that you get it early intervention,
Yeah, yeah,
during
yeah.
that
But
young age,
sometimes it's about,
to
cultural
before.
differences and increased awareness. Yeah, if
Yeah,
I've seen people that says, "Oh, we didn't hear that about, and let's say 1 or 2 years behind, or
yeah,
one or
yeah.
two
Well,
years from
sometimes
now."
14, 15 years
So it is,
behind,
yeah, yeah,
but
yeah. I've
it
seen
just
I've
takes
seen
longer.
people, go from town to town, try to find an ABA providers. Yeah,
Hmm. Yeah, but when you're talking about an adult, of course, it takes a lot more time. It's not something that, they'll learn this skill. Maybe
yeah, of
a
course.
child at 3 years old might learn this skill
Yeah,
in 2 or 3 months. but an adult might learn it in a year. So,
Yeah,
when you're talking about
might take a
adults,
little longer, yes,
yeah,
but yeah, we have to be
the caregiver
persistent.
needs to
We
be,
need to be,
yeah, the caregiver needs to be patient to understand
yeah,
that this is going to
yeah,
take time. It's not going to be like if the child was
yes.
it was a 3-year-old child when you're talking about adults.
Yeah, it's gonna take time. It's gonna take persistence. It's gonna take, a lot of efforts, but eventually it is gonna get there.
Yeah, yeah, yeah. Okay, with this, we're going to end. And thank you, everyone, for joining us today. And I hope to have
Thank
Isra
you.
back next again, sure, soon, hopefully with no
Sure.
technical issues. So, so inshallah, I'll see everybody in the next video.
Inshallah. Yeah, yeah. Thank you for having me. Thank you. I had a great time. Thank you.
You're very welcome.
Perfect.